Assalamu alaikum. So today we will discuss about the optic nerve pathway. So what is optic nerve? It is a second cranial nerve and it is a pure sensory nerve. The function of optic nerve is it is responsible for vision. So talking about the pathway of optic nerve, so it starts from back of the retina and it has two types of fiber. The medial one are called the nasal fiber and the lateral one are called the temporal fiber. But the interesting thing is that these fiber carry always the opposite field. Like if we are talking about the nasal fibers which are present medially, they will carry the temporal field, while the temporal fiber which are present laterally they will carry the nasal field. So optic nerve starts from retina, both the fiber come downward, and at the level of optic chiasma what happen, only the nasal fiber get crossed. What is the meaning? Means the right eye nasal fiber go toward the left side and the left eye nasal fiber come toward the right side. So at the level of optic chiasma only the nasal fiber get crossed while the temporal fiber remain on the same side, right? After that what happened, the optic tract is formed. Now this optic tract contain the same side temporal fiber and the opposite side nasal fiber, right? You need to remember this thing so that when we will talk about the pathology of optic nerve, you will clearly understand. After that, the optic nerve enters into the lateral geniculate nucleus of the thalamus. Then it forms the optic radiations, and these optic radiations finally terminate in the occipital cortex, right, where the primary and secondary occipital areas are present to identify different types of visual stimuli. Okay, so if we talk about the visual field defects, so there are different types of visual field defects which you need to understand. So first visual field defect is called complete monocular vision loss. So complete monocular vision loss means that patient will have the complete vision loss in the same eye, and it will happen when there will be the lesion at the level of optic nerve, right? So here I have labeled it with A. So A means that optic nerve is damaged at the level of optic nerve from where it's starting. So if there is the damage of left optic nerve, then patient will have complete monocular vision loss in the same eye or the left eye, right? Then level B, this is at the level of optic chiasma. So at the level of optic chiasma, what is happening actually, the nasal fiber are crossing and temporal fiber are on the same side. And we have talked that the nasal fiber carry the temporal field. So if at the level of optic chiasma both the nasal fiber are crossing, so what will happen? The nasal fibers of both eye are damaging. So patient will have the visual field loss of the temporal side of both eye. So patient will have what condition? Bitemporal hemianopia. There will be the vision loss of the temporal field of the both eyes. Then there is the level C, which is at the level of optic tract. Now optic tract is a term in which there is the temporal fiber of the same side and the nasal fiber of the opposite side, right? So what will happen if there is damage at the level of optic tract? The patient will have a condition called contralateral homonymous hemianopia. Contralateral means opposite side, right? If there is, this is the left eye, then patient will have damage on the right side. And homonymous means same side of the visual field, right? Same side. And hemianopia, half, not the complete. So if there is damage at the level of optic tract, what will happen? The contralateral homonymous hemianopia, you will get this pathology. Then what happen if patient's optic nerve is damaged at the level of occipital cortex? Then there will be again the contralateral homonymous hemianopia at the level of D. But there's one more thing. You can see that the central part is not involved. This central part is called macula. Macula is a central part of the, is a tiny spot which is present in the center of retina, but it is not affected at this level D. And what is the reason why there is sparing of macula? Because macula is an area which receive dual blood supply from both the middle cerebral artery and the posterior cerebral artery. That's why there is the macular sparing. So level D, patient will have the contralateral homonymous hemianopia with macular sparing. So this is very important, right? So it was all about the optic nerve pathway. Hope you will understand. Thank you.